The CDC says they are seeing a rise in the number of children being admitted to the hospital for COVID-19. And with children making up almost 30% of the population, Utah does have a vested interest in getting kids vaccinated. In today's Wellness Wednesday, I'm joined by registered nurse Katrina Jensen with Intermountain Healthcare. Katrina, hi. Let's first off break down some of the local data on children and COVID-19.
Yes, in Utah, we've had about 78,000 children who have been diagnosed with COVID-19, which is awful, of course. We hate to see any of our kids, right, diagnosed with COVID. We know how serious it can be. We also have seen this other serious rare side effect called MISC, and it has affected about 78 children in Utah. And those kids have been hospitalized, many in the ICU at Primary Children's, very, very sick. That diagnosis involves multiple organ systems: kidney, heart, lung, skin, brain. So if you're a parent of a child who has had to go through that, of course, you would do anything possible to prevent that and keep our children healthy.
Katrina, tell me, what are some of the worries you're still hearing from parents in regards to getting their children vaccinated? And what would you say to that?
You know, I think some of the concerns are that they haven't, for some reason, trusted the vaccine for children, particularly, and or maybe adults. It could be an overflow from their own perception of vaccines. You know, we know that 99% of the COVID cases in Utah have been to unvaccinated individuals. That is a huge number. So if you are vaccinated, the chance of you getting COVID are extremely rare. The FDA, the CDC, everyone is promoting this. All the care providers in Utah at Intermountain Healthcare throughout the state know that it's safe, it's effective. The studies were run according to the CDC guidelines, et cetera. We have Dr. Pravia in Utah, who's been all part of that, Dr. Sheffield with our vaccination team. I mean, we have bright people telling us that this is completely safe and you should get your young 12 or older child vaccinated, especially right now in the summer when you want to get out, you want to travel, they won't have to wear masks, they can go back to school in the fall without that worry of bringing that COVID home again to their family. Because if they can get vaccinated and the adults are vaccinated in the family, then it's a win-win, right?
And those vaccinations are easy to get here in Utah. Where can parents go to get their young children, as young as 12 years old, vaccinated?
Yeah. The first thing is, if you have questions, talk to your provider, talk to your family medicine, your pediatrician, have that conversation. The next thing is you can go to any Intermountain community pharmacy, which we have a lot of community pharmacies, and just walk up and get that vaccine taken care of. You can also, call Primary Children's. We have had some vaccines going on at Eccles, at our community building across the street, but the best place, probably the most reliable, because we have so many kids in Utah and different touch points, to go to that community pharmacy at Intermountain Healthcare. The hospitals, the Instacares, et cetera. There are many pharmacies throughout. And we're going to give that information in a few minutes as well.
Yeah, and we'll put all of that information on our website if you'd like to visit fox13now.com. No appointment necessary for these vaccines, makes it even easier. Katrina Jensen with Intermountain Healthcare, thank you so much.